Welcome back to the deep dive. We're here to unpack complex topics, get you informed, and do it quickly. Today, we're looking into something that, well, it might sound a bit niche, but honestly, for anyone who cares about horses, it's absolutely vital. We're talking about conditions that cause significant discomfort, really impact breeding, and sometimes, tragically, even lead to euthanasia.
Exactly. And our mission here is to, really dig into equine penile trauma and paralysis. We want to get to the bottom of the causes, the signs, the treatments, pull out the key insights so you can grasp how complex and, frankly, interconnected these issues are. Because, as you'll hear, these aren't just one-off things. They often start a pretty nasty cycle. Swelling leads to more damage, and it just spirals if you don't act fast.
That cycle sounds critical, the interconnectedness. Okay, so let's start with penile trauma, specifically lacerations. What exactly are we talking about when we say laceration on a horse's penis?
Right. So penile lacerations are basically cuts or tears. They can be just on the skin, superficial nicks, or they can go much deeper, sometimes involving the underlying tissues, even the main erectile tissue, corpus cavernosum, or the urethra itself. That's the tube for urine, of course.
And how do these typically happen? Are we looking at just random bad luck, or are there common scenarios?
It's often specific situations. Breeding accidents are very common, especially for stallions. Think about kicks from mares, particularly if she's not receptive, or getting tangled in tail hair. Even things like breeding stitches, Caslick sutures if they're not removed beforehand, or just getting caught on a fence or something during breeding.
Makes sense. What about outside of breeding?
Oh yeah, environmental trauma is a huge factor. Getting caught on fencing, wire, branches, sharp stuff in the stall or pasture. Sometimes it's self-trauma too, like rubbing from itching, or even falls, blunt impacts. And less commonly, there's iatrogenic causes, accidental nicks during vet procedures like sheath cleaning, or even chemical irritant exposure.
You mentioned those iatrogenic injuries, the ones caused during procedures. What are the key things vets do to prevent that? Because it sounds like a delicate area.
Absolutely. It's all about meticulous care. Proper sedation is key so the horse is calm. Good lighting, obviously. Using the right tools designed for delicate tissues. Gentle handling. For sheath cleaning, for instance, we use blunt instruments, gentle flushing.
Yeah.
It's about being mindful of the anatomy. And like I said, chemical exposure is rare, but we're careful about what substances are used near that area.
Okay, so for an owner, if they suspect something's wrong, what are the absolute telltale signs? What makes you think vet now?
Bleeding is often the first thing you see. Could be mild oozing, could be quite significant hemorrhage. Then there's the visible cut itself, the laceration on the shaft or the glands, the tip. Swelling or edema is really common. And it can happen fast. Sometimes you get a hematoma, that's blood pooling in the tissue. And this swelling is crucial because it can quickly lead to paraphimosis.
Paraphimosis, that's when they can't retract it, right?
Yeah, exactly. The inability to pull the penis back into the sheath. It's a major complication. You also likely see pain, reluctance to drop the penis, sensitivity to touch, maybe changing stance during urination. And if the urethra is involved, you might see urine dribbling from the wound or pain during urination. And of course, watch for infection signs, redness, heat, pus, any foul odor.
Sounds like a clear emergency. So the vet gets there. How do they figure out exactly what's going on? What's the diagnostic process?
First step is a really thorough visual exam, looking at the whole penis and prepuce. This usually needs sedation, keeps the horse comfortable and still, and we often have to manually extend the penis from the sheath to see everything clearly. Then, gentle palpation, feeling the wound depth, checking for hematomas, assessing deeper structures. We might use a sterile probe carefully to check depth. And urethral catheterization, putting a tube in, confirms if the urethra is intact.
Is imaging involved, like x-rays or ultrasounds?
Ultrasound is very useful, yeah. It helps us evaluate the swelling, the edema, any hematomas, and critically, damage to the erectile tissues, the corpus cavernosum or spongiosum. If we suspect a urethral tear, we might do endoscopy, specifically urethroscopy, to look directly inside the urethra.
Okay, diagnosis made. What's the treatment plan look like? You mentioned acting fast.
Absolutely. Time is critical. First aid is key. Control the bleeding, direct pressure, clean the wound thoroughly with a mild antiseptic, make sure tetanus protection is current booster or antitoxin. Then NSAIDs, those are non-steroidal anti-inflammatories for pain and swelling. And if there's been significant blood loss, IV fluids are essential for stabilization.
And the wound itself, is it always stitches?
Not always, but often preferred if possible. If the wound is fresh, clean, ideally less than, say, 6 to 8 hours old, primary closure, meaning surgical repair, is best. That involves cleaning up the edges, removing any dead tissue that's debridement, and then stitching it closed with absorbable sutures. And here's something really important. If the laceration involves the tunica albuginea, that tough outer layer of the erectile tissue, it must be closed surgically.
Why is closing that specific layer so critical?
Because if it's left open, it can cause shunting. Blood bypasses the erectile tissue, meaning the horse might not be able to get an erection properly in the future. If the urethra is torn, that often needs surgical repair too, sometimes with a temporary urethrostomy, a new opening to divert urine while the urethra heals. Now, for older wounds or contaminated ones or really extensive damage, we might opt for second intention healing.
Second intention, what does that involve?
Means we manage it medically. Daily cleaning, careful debridement of dead tissue, applying topical antibiotics or ointments, basically letting it heal from the inside out without sutures closing the skin initially.
Once the wound is dealt with initially, what about managing that swelling and preventing more problems?
Supportive care is huge, yeah.
Hmm.
Especially managing that edema. We might wrap the penis with a soft compressive bandage, changing it often, or use a sling to support it against the belly. Once the swelling is down enough for retraction, we might use a temporary purse string suture around the sheath opening, or even a device like a modified plastic bottle, just to help keep the penis inside and stop paraphimosis from happening again. Systemic antibiotics are usually given, broad-spectrum ones, to fight off infection, and for swelling reduction. Cold hydrotherapy, manual massage, and osmotic agents applied topically like sugar paste or hypertonic saline, they help draw fluid out.
Now, you mentioned something earlier, critical warning for stallion owners, things you absolutely should not do.
Yes, absolutely crucial points here. First, no sexual stimulation. None. Until healing is totally complete. Any attempt could just ruin the repair or cause more damage. Second, and this is vital for everyone working with horses, phenothiazine tranquilizers like asapromazine. Never use them in intact male horses.
Never. That sounds serious. Why is asapromazine such a risk?
Because it has a known, though thankfully uncommon, side effect. It can cause priapism, that persistent unwanted erection, or even permanent penile paralysis. It's a serious risk associated with that specific drug class in stallions. It's something every owner and vet needs to be acutely aware of.
Wow. Okay, that's a really important piece of information. So putting it all together for lacerations, what's the general outlook, the prognosis?
Well, for small, superficial cuts that are treated quickly, prognosis is generally good, often full recovery. But for deep wounds, extensive ones, especially if they involve the urethra or that corpus cavernosum tissue, or if there's severe infection and that persistent paraphimosis sets in, the prognosis drops. It becomes guarded, sometimes even poor. Potential long-term issues could be urethral strictures, issues with erection like priapism, or leading into our next topic, permanent penile paralysis.
Right. Perfect transition. Penile paralysis. This sounds like a step beyond just being unable to retract temporarily. What exactly is it?
It is. Penile paralysis is essentially a severe, permanent form of paraphimosis. The horse completely loses the ability to voluntarily retract the penis. It's not just temporary swelling. It's due to actual damage to the nerves, the internopudendal nerves, and the muscles responsible for retraction, the retractor penis muscles. The result is a flaccid, permanently hanging penis.
And what causes this level of damage? Is it usually linked back to the trauma we just discussed?
Often, yes. And this is a key point. The most common cause is actually prolonged paraphimosis itself. Remember that vicious cycle we mentioned? An initial issue causes the penis to prolapse. If it stays out, chronic, severe swelling edema develops. That sustained edema stretches and damages the retractor muscles and their nerves, sometimes irreversibly. So what started as potentially treatable paraphimosis becomes permanent paralysis if not managed aggressively early on.
So the initial cause of the prolapse could be trauma, but the paralysis itself comes from the consequences of that prolapse.
The edema.
Precisely. But there are other direct causes, too. We already mentioned one surprising culprit, the phenothiazine tranquilizers, like asapromazine.
Exactly. It's a well-documented cause. The way they work, their alpha-adrenergic blocking effect, causes too much vasodilation, widens blood vessels, relaxes muscles in the penis. This can lead to that persistent prolapse, then the edema kicks in, and that damages the nerves and muscles. It's particularly a risk with higher doses or just susceptible horses, a routine sedation gone wrong, potentially.
That's sobering. Are neurological diseases also a factor, things affecting the nerves directly?
Yes, definitely. Anything affecting the spinal cord or the peripheral nerves that control retraction can lead to paralysis. Conditions like cauda equina syndrome, which can result from things like EHV1 myelopathy, that's a viral neurological disease, or nerve inflammation called polyneuritis equi, or spinal trauma, even tumors. Rabies, though rare now in many places, can cause it. Direct injury to the sacral nerves is another possibility. And then there are other factors: severe debilitation, extreme weight loss, cachexia,
Oh,
also priapism, if that persistent erection lasts long enough to cause ischemic damage. And sometimes large tumors on the penis or prepuce can physically prevent retraction or damage nerves.
Okay, so a range of potential causes. What does penile paralysis actually look like? What are the signs an owner would notice?
The main sign is obvious. The penis is persistently prolapsed, hanging flaccidly, unable to be retracted. Over time, because of the chronic inflammation and scarring from being exposed, the penis and prepuce usually get really swollen, and they can become firm, hard, even we call that indurated. The exposed tissue is vulnerable, drying, cracking, ulcers, infection, even tissue death, necrosis from poor circulation or constant pressure. You'll often find a lack of sensation if you test it, due to the nerve damage. Urinary problems are common too: dribbling, incontinence, leading to urine scalding on the legs and belly. And for stallions, obviously, breeding is impossible. They can't achieve erection or breed naturally. Sometimes you even see weight loss if the condition is painful or distressing enough to affect appetite.
With those pretty clear signs, how does a vet confirm it's paralysis and not just severe, stubborn paraphimosis?
Well, the chronicity is a big clue. Persistent flaccid prolapse with that characteristic chronic swelling and fibrosis points strongly towards paralysis. Palpation helps assess that fibrosis, the lack of tone, and checks sensation. A full neurological exam is really important to see if there's a bigger underlying neurological problem causing it. Imaging, especially ultrasound, can show the extent of fibrosis, maybe nerve damage, or rule out masses. If we suspect a tumor, a biopsy is needed. And lab test blood work, maybe tests for viruses like EHV1, help identify any systemic causes.
Given the nerve and muscle damage, treatment sounds difficult. Is recovery of function even possible?
It's very challenging, you're right. Full recovery of function is often unlikely once true paralysis sets in. The goal shifts. In the very early stages, if we catch it before severe fibrosis, we might try intensive medical management, similar to treating acute paraphimosis. Aggressive edema control, cold therapy, massage, those osmotic agents, protecting the tissue topically, systemic NSAIDs, antibiotics, trying manual reduction and using slings or retention sutures. We might try this for days, maybe weeks. But if there's no improvement or the damage is clearly irreversible, surgery becomes the main option, usually a salvage procedure.
Salvage procedure sounds serious. What does that typically involve?
The most common one is philectomy. That's amputation of the penis. The damaged, paralyzed portion is surgically removed. And a permanent opening for urination, a urethrostommy, is created, usually lower down in the perineal area. This is done for irreversible paralysis, severe necrosis, untreatable tumors, or chronic paraphimosis that just won't resolve. The horse obviously becomes infertile, but the procedure removes the source of pain, infection, and the physical burden. They can live a comfortable life afterwards, though some urine scalding can still be an issue sometimes.
Penile amputation, that's quite significant. Are there modifications or other surgical approaches?
There are. A more cosmetically refined technique is partial philectomy with retroversion. The remaining stump is surgically inverted, tucked back into the sheath or a new opening. It can look better and maybe reduce scalding. Other options are much less common, maybe surgical nerve repair if caught extremely early, but that's rare. Resecting some of the fibrotic tissue, a procedure called phallopexy to try and tighten the sheath opening, or even removing part of the retractor muscle in myectomy in very specific unusual cases. But really, philectomy is the mainstay for true paralysis.
So, considering these often drastic measures, what is the long-term outlook, the prognosis for a horse with permanent penile paralysis?
For breeding function, it's guarded to poor, essentially zero for natural breeding. Stallions are rendered infertile. Collecting semen via an artificial vagina usually isn't feasible either, due to the inability to get an erection. However, for quality of life, with a successful philectomy, the prognosis is generally fair to good. They can live comfortably as geldings or as non-breeding stallions. The force of chronic pain and infection is gone.
Interesting. So breeding is out, but what about their behavior? Does the libido go away?
That's a fascinating point. Often the libido, the sexual drive, is actually maintained, even though they physically can't perform the act. Sometimes with a lot of training and specific techniques like using hot compresses for stimulation, maybe certain drugs like tricyclic antidepressants, some stallions can still be collected using an artificial vagina. But it's intensive and not always successful. But the key takeaway is that unaddressed paralysis leads to ongoing complications. Worsening paraphimosis from edema, frostbite in cold weather, ulcers, infections, tissue death. Action needs to be taken.
So if we boil this entire deep dive down, what's the single most crucial message for our listeners?
It's straightforward. Any sign of penile trauma, or especially if a horse cannot retract its penis, get veterinary help immediately. Prompt attention is absolutely paramount.
Right. Because as we've heard, catching these things early, treating them aggressively, it's not just about immediate relief. It dramatically boosts the chances of a good outcome, potentially saving function, saving breeding careers, and ensuring the horse's long-term health and comfort.
Precisely. Early intervention makes all the difference.
And when you think about all the detail, the specialized treatments we've discussed for these, well, very specific equine issues, it really makes you consider the depth of veterinary commitment, doesn't it? And maybe the incredible complexity that's hidden in what seem like simple biological functions, something to ponder. Keep exploring, keep learning. There's always more beneath the surface.